Hi, my name is Scott, and today I'm going to be talking about intubation. So what I want to do first is indications. Indications for intubation is basically going to be airway, if the patient's airway is compromised, if they're in cardiac arrest, or if they're in respiratory failure. Those are indications. Contraindications would be DNI, which stands for do not intubate, which means you do not intubate the patient. Complications could be vocal cord paralysis, vocal cord stenosis, and Malaysia. Yeah. Now, when you review the patient's chart, you want to make sure that you check if they've been intubated before, any previous intubations. Maybe they might have a size, so check to see if they already have a size. And then check their Mellon-Patty scores. And yeah, after that, you want to check, my bad, you have to go and grab your necessary equipment. So today, your equipment's going to be, I got an ET tube, and this is a size 8. So for ET tube for a female, it would be a 7.5 to 8.5, and for males, it would be 8 to 9. You're gonna have a stylet in there, which is this thing. It's gonna help guide it, and then you have you should check to see if the cuff is working properly. So you want to inflate it, and it is. You want to make sure it's not leaking, okay? And you want to deflate it before you do your procedure. Okay. After that, you want to make sure you grab your suction catheter, and then you also want to grab your manometer, which is to check the cuff pressure, which should be like about 20 to 30. You want to make sure you have your CO2 detector, a calorimeter, and then you want to make sure you get your HME, which is a heated moisture exchanger, which is going to be connected to your suction catheter. OPA if needed, a block bite if needed. Right here, you're gonna have your lube, which at this point you can rip the top lube, the very the tip of it, and then yeah, you get into your intubation. You want to make sure you have your ambu bag with the mask. This is for so your assistant can hyperoxygenate the patient before, and you want to make sure that it works. So your 3-step check: ductal opens, and you want to make sure that it inflates when it's closed, and you want to make sure that you can, yeah. It doesn't, yeah, okay. No. Press down, okay. Stethoscope. You also want a laryngoscope. And you're going to have 2 types of blades. So you can pick one or the other. You're going to have a Miller, which is this one. This is a straight blade. And this one directly moves the epiglottis. While the Macintosh, like mac and cheese, scoops, it's curved. This one moves the epiglottis indirectly via the vallecula, and you want to check and see if your laryngoscope is properly working by checking the batteries. If it's in there, if it is, okay, check the light. Light should be on. If not, switch them. So yeah, you can also check the light before by just pressing down, and it should flash. Okay. Okay, and your CO2 detector is going to turn yellow or gold when there's CO2 detected, and purple if it's poor. Alright, so after that, you're going to want to enter the patient's room with your assistant, and then you're going to wash your hands, which is the hand sanitizer. Hello.
Hello.
Okay. Thank you for helping me.
Oh, you're welcome, sir.
Okay.
Dr. Suswati.
Oh. I like that sound. Okay, so when you come into the patient's room, put your gloves on, you want to make sure you introduce yourself to them, and then you want to make sure you explain what's going on. You want to make sure that you check the patient identifiers, which is their first name, last name, date of birth, and then check their wristband. So Mr. Jeff over here, he's going to probably have family members over here. You want to explain, okay, today we're going to do an intubation procedure. This is an elective procedure, not emergency. So there's elective intubation and emergency intubation. Elective means he's probably going to surgery, or the patient decided, hey, intubate me. It's okay. So now that they said that, because they need to breathe better. Yeah. You come, you explain, okay, sir, I'm gonna be putting a tube down your throat, and it's gonna basically help you breathe easier. It's gonna give you oxygen, and it's gonna make your airway patent and opened. Okay. After they understand that, the patient should be on a monitor. If not, then you could put like a pulse ox on, check the saturation levels, check the heart rate, check respiratory rate if needed, and then take a listen to the lung sounds. There's like no room because I'm fat. Okay. Okay, take a listen to the lung sounds. Okay. Okay. So I'm gonna explain that with intubation there's the oral way and then there's the nasal way. So with blind nasal intubation, you're gonna basically go through the nose, and you're gonna blindly go in and use the McGill forceps, and you're gonna put it down the throat, and you're gonna put on you're gonna listen on the trachea for air, for sounds. You're gonna listen to it, and that's when you know that you've reached and it works. The other one would be a visual nasal intubation, which means you can use a laryngoscope, you can use a King's, I think it's called a King scope, and then you basically put down the tube through the nasal area while using the scope and the McGill forceps and guiding it through. So that's that. Right now we're going to be doing regular oral intubation. So when you intubate, you want to make sure that you flush your oxygen, and you let your assistant hyperoxygenate the patient for about 3 minutes. After 3 minute passes, you can go in and intubate, and you have 30 seconds. And if it's longer than 30 seconds, just come out and then re-hyperoxygenate the patient again for 3 minutes. Okay? Alright. So, yeah, it's been 3 minutes. Okay. So, make sure to not crank and hit the teeth. So go in. Push forward motion. Okay. Okay. Got it. When you pull out, you also want to pull out slowly and not hit the teeth. Alright, you want to keep on holding the tube, pull out the stylet, oxygenate the patient, check where you're at with the teeth, and then at this point, you want to make sure that, can you hold it? Thank you. Make sure you don't ever let go. You want to listen to, you want to see and hear. You don't want to hear any air in the stomach to avoid damage, so you take a listen to the stomach area. And after that, you want to take a listen to the chest area, and then you want to look out for bilateral chest rise or a symmetrical chest extrusion. And after that, you also want to make sure that you're in the right area by looking at the CO2 detector. It should turn yellow or gold for CO2. And you want to make sure that during exhalation, you'll see condensation on the tube. And this person right now is at 23 at the teeth. Woo. So after he's at 23 at the teeth, you want to make sure you grab, he's already inflated, sorry. This is going to be connected to a ventilator, so what you do is connect the patient, boom, and this should be connected to a ventilator. Alright, now it's secured like that, so hold it real quick. I'm going to check the cuff pressure just to make sure, 20 to 30. About 25 is good. Okay? And you have your necktie. We're going to use the rope. Tie. Okay. Now, at this point, thank you very much. Okay, you're just going to help me hold it. And you don't want to cover the numbers, but you want to be as low as you can, alright? So, you want to keep your tie overlap with each other. Okay, you don't want to. Okay. you don't want to tie the cuff with it too, so make sure you check that. After that, okay, she's still holding on to the tube, so now I can put the rope over, tighter. Okay, make sure that it's tight. Secure it, tie a knot. Alright, so now that it's in place, you can let go. I'm going to reassess your patient. You can listen to lung sounds again if you need to now. Take your time. Listen to the stomach area. Check for consolidation over here. And then you want to make sure to get a chest x-ray. So you want to make sure that it's 3 to 5 centimeters above the carina for proper placement. And then you could put gauzes over here to make sure that there's no skin breakdown. And yeah, your patient is intubated. So after this, you can take all your necessary equipment, take it out of the room, and you're gonna put your endoscope to start processing whatever that needs to be sterilized. And make sure you suction the patient if suction is needed. You can also use the suction before if there was secretions before the intubation. You could do that, and always check the cuff pressure before you leave the room to make sure that it's at the right level. And I think that's it. You step out of the room and you chart, write down things, important things. Yeah, okay, I think that's it.